The thing about women's cancer is that 40% of all cancers that occur in women are cancers of reproductive organs, female-specific cancers of the breast, ovary or uterus. Whereas in men, for example, it's only about 15% of cancers of the prostate or testis. So a very large proportion of cancers in women are female-specific cancers. Well, it varies for every cancer, and I'll just talk briefly about each cancer. For cancer of the cervix, we've known for a long time it's sexually transmitted, that pap screening by pap smears works very well, and now we've got a vaccine against papillomavirus. So we know really what to do about preventing cervical cancer. It's very hard to implement, but we've really got the clues. There's the big picture. We know the big picture, we know the big solutions, but implementing them is very hard. For cancer of the womb, that's the endometrial cancer, and for cancer of the ovary, both of which cancer of the womb is a bit more common than cancer of the ovary, but not much. The main thing we know, which curiously is not said as often as it should be and been known for decades, is that the pill has a long-lasting, strong protective effect. People who've taken the pill when they were in their teens, 20s or 30s for 10 years have a halving in the risk of endometrial and ovarian cancer, which is very profound. And we estimated, based on the worldwide evidence, that so far about 400,000 endometrial cancers have been prevented by the pill and 300,000 ovarian cancers. And it's a very easy thing, and we know that there are no long-term adverse effects of the pill. So I think that there should be a lot more said about young women should be encouraged to take the pill. Breast cancer is more common than the other three put together, and it's particularly common in the West. And we actually know, and there was another, I wasn't the only one who said so far at this meeting, when you go through all the evidence that we've got about breast cancer, we actually understand most of why breast cancer is common in the West. And most of it is because of childbearing patterns. It's if women in the West had as many children as, say, in low-income countries and breastfed them for as long, had 6 or 7 children, breastfed each for 2 years, you would more than halve breast cancer rates. And then there are other things that add a bit, like people who are overweight, people who drink alcohol and use hormone therapy. There are other things, but they're not the big story. The big story is childbearing patterns. And the sad thing about that, and I will say that that's because a lot of my work has been looking at hormones and breast cancer, the pill and hormone replacement therapy. And when I started in research, people used to say the reason breast cancer is common in the West is because of the childbearing difference, having children. But the effects of children is mediated by estrogens and progestogens. So if that was true, the pill should have protected against breast cancer, and it doesn't, which means that we don't know how to prevent breast cancer. They should be afraid of HRT. HRT, particularly the combined estrogen plus progesterone, really has a very bad effect on breast cancer. There is a big risk. But the sad thing, the pill actually slightly increases breast cancer while it's being on, but while it's being taken, but it goes away. It's not a persistent effect. It's quite different to the effects of the pill on endometrial and ovarian cancer, where it's strongly protective. The overwhelming evidence at the moment is that the pill, on balance, everything put together, women who've taken the pill for a long time are less likely to get cancer in total than women who haven't. And it's largely because of this long-term protection against ovary and endometrial cancer. Sadly, the pill does not reduce the risk of breast cancer. If anything, it slightly increases the risk in the short term. But that's not a very big effect. So the pill, in the long term, and women who've taken it are better off in terms of cancer. And there's no reason in my mind why they shouldn't be told that more clearly, and that really taking the pill for a long time is a good thing. Diet has no role in these cancers, just as a summary, and I think that's generally agreed. Diet doesn't, and effectively, tobacco doesn't have much effect either. It's neither diet, tobacco. Alcohol does. Alcohol does increase breast cancer risk, and that's quite important, particularly people are drinking more than they used to, but tobacco doesn't have much of a role. Screening works for breast cancer, screening works for cervix cancer, so go for screening. For cervix cancer, if young people should be vaccinated. In general, taking the pill for prolonged periods is good for cancer in the long term, and there's a very small increase in breast cancer risk in the short term, but that goes away. But there's profound and long-term, lifelong protection against cancer of the ovary and endometrium, and that is good. Hormone replacement therapy, particularly combined, is not. It really has a substantial increase in breast cancer risk.